What's up, y'all? Welcome back to the channel. And if you're new here, my name is Andy. I'm a physio from the United States who specializes in helping soccer players recover from injury. So, Reece James, a very tough year for him, missed out on the World Cup because of a knee injury and recently had to leave his most current match in the Premier League with another injury setback. In this video, we're going to discuss his current injury as well as his initial injury, which is why he likely missed out on the World Cup in between. So to start off, let's look at the injury that Reece James suffered just yesterday while playing for Chelsea. So if you're looking at the film, you'll see that there's likely nothing quite obvious to the eye. And if you're kind of watching this, you might be wondering to yourself, well, I don't really see any injury at all. But obviously, he did end up having to go down and was subbed off. And Chelsea actually released a statement afterwards, which pretty much confirms that this was a re-injury. It reads, defender Reece James underwent assessment earlier today after being substituted during the second half of last night's Premier League victory. Scan results have regrettably confirmed a setback for the 23-year-old, with Reece now set to be ruled out for up to a month. And the key word out of that statement there is injury setback, because that pretty much confirms that this is a re-injury of his initial injury. So what was Reece James' initial injury? Well, this actually took place at the start of October during a Champions League match versus AC Milan. And when you see the video of this injury, it starts to make a little bit more sense as to why there might be something going on. You can see there's a clear hyperextension mechanism of the knee, which gives us some clues as to what structures might be injured. And there's really only three structures that come to mind at this time. One is obviously the meniscus. It's a piece of tissue that sits between the upper thigh bone and the lower shin bone, and its job is to absorb force. And anytime you have any sort of aggressive knee motion outside of its normal range, that meniscus could possibly be injured. And depending on the severity of this injury, you can elect to either go for surgery or just do rehab. And all of those timelines are vastly different, which leads us to our other possibilities of what could be happening in that knee, namely an injury to one of his knee ligaments. Because of his hyperextension mechanism, it's possible that he has either a sprain or a partial tear of one of the cruciate ligaments in the knee, being the ACL or the PCL. And although that may sound scary, it's often quite common for soccer players, especially as they get older, to have partial tears to some of these ligaments inside of their knee that cause almost no symptoms. Now, obviously, it's not the case for Reece James, as he went down in significant pain, but it does go to show that you can rehab some of these partial tears or sprains without going through surgery. And if this was the case for Reece James, it's likely why he's been at Chelsea doing rehab for the past 2 months. Now, in terms of a future recovery, the club also said in their statement that he's going to be out for up to 1 month, which means they likely have a very firm picture as to what's going on, a proper plan of care and treatment, including going from the treatment room back onto the pitch. All in all, we just hope Reece James is feeling better after this injury and he returns to the pitch as soon as possible. But I hope you guys enjoyed this video. Again, be sure to like, comment, share, and subscribe to stay tuned to all of soccer's biggest injury tips and updates.